Hello, good afternoon. This is Michael Joseph Deal, MD, a student who graduates from med school and wants to be a psychiatrist. Only needs to have 3 months of medical training, that is, on a medical unit in the internal medicine setting, to fulfill that part of his psychiatric training. I personally don't think that's an adequate amount of time. When I was a medicine resident for 2 years, the first few months that you're an intern, you're just hoping you don't hurt somebody. Scared to death, especially when you're on call at night by yourself. And after about 3 months, you start to develop some confidence that maybe you can do this, maybe you're smart enough and you're not going to hurt anybody by mistake. But then when you only have to do 3 months and they pull the plug and say that's all you need to do, you never go ahead and become really comfortable like you should be and become a full-fledged medical doctor. So I think that's a flaw in the training programs of psychiatry. There are several programs now on the Eastern Seaboard, I've been told, that require 2 years of internal medicine and 3 years of psychiatry, which is what I exactly did, and that is a fantastic combination. I think psychiatrists tend to stay away from medically ill people. They tend to not take any chances medically because they just don't feel comfortable with their funded medical knowledge. And I've been around enough of them. I think this is true. So, how can you somehow improve your chances of finding a competent psychiatric provider? Here's what you have to do, I think. Knowing that the people you go in to see, most of whom may be primary care doctors, but some who may be psychiatrists, you have to somehow guide them to the right spot for you. Antidepressants are woefully inadequate and they're dangerous to be used in treating depression. And actually, this is because most people who are depressed have bipolar depression, bipolar type 2. They don't know that, and I know darn well the family doctor doesn't know that. And half of all cases of bipolar type 2 depression, when seen by competent board-certified psychiatrists, are missed. They miss the diagnosis. So you get treated for major depressive disorder. There are a number of world-class researchers that do not think that diagnosis even exists, and I'm one of them. So here's how you do it. You go into a doctor, and more often than not, it's going to be a primary care physician, and you tell them about your depression, and you have to be, I think, forearmed to be prepared to do this. And he starts talking about starting an antidepressant, and you have to say, "Doc, hang on there, would you?" So I have been on any number of these, and they don't work at me. They make me worse. I get suicidal thoughts possibly, or I have a lot of friends that have tried them or family relatives, and they just don't work. And you steer them towards what are called atypical medications. Atypicals are medicines used to treat bipolar depression and sometimes schizophrenia, but they won't do to you what antidepressants will do. And some of these drugs are Latuda, Caplyta, Seroquel, and Vraylar. These are some of the more modern medications that are called atypicals. They work differently in the brain than the old standards like Haldol and Thorazine, those kind of drugs. So, and they have fewer side effects, but they're also many of them are approved for bipolar type depression. So your chances of having a decent outcome are dramatically better. But you have to be very proactive, and you have to take charge of the situation. And if the doctor gives you a real hard time, just go see somebody else. Forget it. And you'll just have to keep looking until you find the right kind of person. The mood stabilizers are the best drugs for bipolar disorder, but I wouldn't expect family doctors to know how to use them. A lot of psychiatrists don't use them regularly, but they are the best drugs of all. I had a patient, in 45 years of treating patients, I've only had one patient come to see me who was taking lithium, one of the best of all the mood stabilizers, without question. And I said, well, I almost indignantly asked, who put you on lithium? He said, you did, Doc, 22 years ago. And he told me never to stop it. I said, good patient. But he'd been on it, never been depressed in 22 years. But most doctors don't know how to use those drugs. Some psychiatrists might feel comfortable using them, some don't, because I don't think they use them very often. I hope I'm wrong about that, but I don't think I am. So if you want to have a chance at finding a mental health professional who you can mold into your kind of guy, do what I said and see what happens. I'd like to thank you for listening to my video, and please subscribe to my channel, hit the like button and the notification bell, and if you have any comments you'd like to make about other videos you'd like to see from me or other type things or questions, feel free to do so. Thank you very much.